I'm Katherine Gudgel. I'm the Manager of Community and Social Services for HealthPoint. I'm responsible for our school-based and homeless health programs. HealthPoint operates school-based health centers at 3 high schools in the Highline and Renton school districts. They're staffed by a medical provider, a behavioral health provider, and a clinic coordinator. These 3 people do an amazing job of working together to provide care to the student populations, both at the high schools and at the middle schools that feed into them. Having our small team that is in the schools allows our providers to interact with faculty and our students to interact with all members of our care team. When a faculty member has a concern about a student, they're able to refer that student, say, to the behavioral health consultant. The behavioral health consultant can help the student with goal setting, with dealing with anxiety or depression, or whatever their barrier may be to performing their best in class. And if there's a medical condition that's also present, the behavioral health consultant can very easily talk to the medical provider who's right there and get that child evaluated for whatever medical issue may or may not be happening. COVID-19 first caused a very abrupt disruption to the school year where the students did not expect to need to be educated remotely, and the school-based health centers shut down briefly. But because all of our schools asked HealthPoint to continue to operate the school-based health centers in their schools, we mobilized pretty quickly to get all the things like personal protective equipment and safety measures that needed to be implemented in order to keep people safe from getting COVID into our operations so that we could continue to see patients in person. At the same time, all patients didn't need to be seen in person necessarily. They could be helped through a televisit, whether that be in the beginning, we only had the ability to do telephone calls. And as time progressed, we incorporated the ability to do telemedicine visits that included both a visual and an audio component. And an interesting thing that we learned in the process of shifting how we provide care is that the telephone visits enabled some students who had social anxiety, for example, to really open up to their providers and be much more open with the extent of their challenges than they were able to do when they had to look at the provider face to face. The fact that they work so closely together and also have great relationships with the faculty and administration of the school allows the students to really have the ability to thrive and to really improve their academic performance because they are healthier, they are stronger, and that just allows them to thrive in every aspect of their lives. We are going to continue to work on our own technology skills so that we can facilitate those connections between students better, as well as continuing to reach out to them directly for one-on-one care.